All right. Good morning, everyone. Welcome to our webinar hosted by Communities Concerned for Immigrants and Refugees. We're just going to allow people a little bit of time to log on here. And then we'll get started with our program. Thank you for joining us. Good morning, everyone. Thank you. We'll get started here in about 1 minute. All right, well, let's go ahead and get started. Good morning, everyone. Happy Thursday morning. Welcome. My name is Andrea Perdomo Morales, and I am the co-chair of Communities Concerned for Immigrants and Refugees. This is an initiative that is sponsored in full by the Reach Healthcare Foundation. This morning, we are fortunate enough to have 3 wonderful speakers that are going to bring updates to us on where we are with COVID-19 vaccines, testing. As we all know, we thought that when COVID-19 started, we were going to be done shortly after a couple of months. And unfortunately, we have seen that the effects are continuing to happen months later, and still learning new things each and every day as we move along this journey in this pandemic. Our focus today is to figure out what is going on with our immigrant and refugee populations. How can we support them? Just give us a bigger picture of that dynamic. So we have with us, we're going to start off with the mental health perspective, and we're fortunate enough to have Tim DeWeese with us this morning. Tim is the director of Johnson County Mental Health Center. The Mental Health Center is a department of Johnson County, Kansas government, and employs more than 360 staff who provide behavioral health services to nearly 12,000 county residents annually. Tim possesses a Bachelor of Science degree in psychology from Missouri Southern State University and a Master of Social Work Administration degree from the University of Kansas. He is a licensed mental health professional in Kansas and has over 30 years of experience in community mental health. He possesses extensive knowledge and experience in the public mental health delivery system, client-centered leadership, and program design and development. Thank you so much, Tim, for being here with us this morning to talk with us about the mental health impact on our immigrant and refugee community members. I'll turn it over to you.
Super. Thank you very much. I so much appreciate being here this morning with you all. What I thought I'd do for the next 20 minutes is just talk a little bit about the impacts of COVID on all of us. Specifically talk a little bit about the overall impact on our mental health, and then specifically talk a little more specific about the impact upon the immigrant or refugee population. So, as we started out saying that we thought that this COVID-19 virus, that we would be going through this pandemic, and that maybe 6 months or so we would be in better shape. And then we got through 2020 and we started to look to 2021. And unfortunately, within the first 30 days of 2021, we see another increase. Not to mention, we began to see even more civil unrest and just hate that permeates our communities. And so I think it's important for us to realize that in addition to this global pandemic, we also have been traumatized by the amount of racism structurally within our communities, the amount of polarization that exists within our communities, and the amount of distrust and and really just uncivil incivility to one another. And so when you combine all of those things, it definitely has had an impact, not only on the people that we serve, but on ourselves. What I'd like to say is that any one of those things would be a traumatic event that we would all need to process and overcome. But when you combine all of those, we have had and we've experienced, going into year 3 now, a sustained traumatic event. And we all need to come to the realization that this global pandemic and all the things associated with it have had devastating health impacts, economic, personal impacts, both individually and with our families and across our communities. The fear and anxiety about the virus and what could happen next can be overwhelming, and it can cause strong emotions within all of us. And so I think it's really important that we remind ourselves that emotional reactions, the emotional reactions of the people that we serve and our own emotional reactions are expected, that they're a normal part of how we process traumatic events, such as those that we've experienced over the last 3 years. Many of us may experience or be experiencing feelings of fear, guilt, anxiety, sadness, depression, even some anger that could result in behaviors such as being more irritable than normal, being oversensitive to situations, being a little short-tempered. I know that for me personally, 2021 was actually harder for me personally than 2020. And that all of us have to realize that not only have we tried to manage this pandemic ourselves, we've tried to manage this pandemic with our clients, but that we all have our own personal lives and our own things that we're experiencing through that makes that even more difficult for us. And because of that, we experience the same things that the folks that we work with experience. Again, I think it's important for us to remember that this is all normal, and that it's important to recognize that other people around us are having the same feelings, the same experiences. So it's more important than ever that we provide a little kindness, a little grace, a little understanding to one another. In fact, in a world where we face so many things that we can't control, the one thing that we can control is how we react and the meaning that we give to this moment in time. I think it's really also important for us to realize how the pandemic is impacting children and young adults. And it's so important for us to model positive behaviors and positive coping strategies for our children and young adults, who in many cases may be experiencing their first loss, their first set of disappointments, their first set of hardships that they're going to have to overcome. These may be truly their first experiences with these things. And so we as adults have to model that positive behavior about how we react and how we provide meaning to what we're experiencing. They may be worrying about their future. They may be worrying about the things that they lost. And so I think it's important that we speak and talk openly about their worries, as well as our own worries, their fears, as well as our fears. It's also equally important that we validate those feelings and acknowledge that these are hard times and there are a lot of unknowns. I think we have to realize that if we catastrophize what's going on, the people, the kids, the young adults around us will also do that. So we must help them cope and build resilience. These two things will help us lead to a better mental well-being within our communities, within our families, and with the people around us. So if we think about the overall impact of mental health, what we know is that the pandemic has impacted everyone's mental well-being, some more than others. And I would like to spend a little bit of time talking about that specifically. People with mental health conditions, people with substance use disorders, or people who are experiencing other traumas may be particularly vulnerable during this time. If stress and anxiety get in the way of your daily function for several days in a row, and you start to experience new symptoms, or the people that you're working with start to experience new symptoms that impact their ability to work and interact with others, then it's important to help them seek professional help. With that said, there's a lot of discussions about the pandemic's impact on mental health and the pressing issues that exist within our community. The fact is that the mental health issues that are currently going on in our communities were going on well before the pandemic ever started. Increased suicide, the epidemic of loneliness that we experience. You know, the research tells us right now that despite being the single most technologically advanced society in world history, people report more now than ever about being alone. And so we have to find a way throughout this pandemic to stay physically distanced, but socially connected. We are lonely, and in my opinion, and what I think a lot of that, what drives that is technology. Technology that was intended to bring us together has found a way to really isolate us and make us more lonely. The issues such as alcohol and drug use, or the acceptance of underage drinking and legalization of marijuana within our community has only been compounded by the pandemic. This is evident by a clear increase in overdoses within our community, which nearly doubled in a single year last year. The absence of civility to one another and the increased microaggressions have also existed well before the pandemic, but has clearly been exacerbated and increased over the last 2.5 years. The pressures to succeed, the pressures that we put on the young people, school-age children, in particular within this community, we focus and we want our children to be the best. We want the best for Johnson County, for our community, for the Kansas City metropolitan area. But in fact, while we ignite the pressure to succeed for young people, we often fail as providers in helping them manage or learn those coping strategies that they're going to need when they experience a barrier. And this has become more evident than ever, both within the young adult population, children, as well as adults. I think we need to also understand the negative impact that social media and unregulated technology has had within our lives and during and throughout this pandemic. The unavailability of healthcare and the stigma associated with seeking healthcare and seeking mental health services were all existing before the pandemic, but they are more relevant and more impactful today. The issues of homelessness and the lack of adequate housing was an issue well before, again, the pandemic. But once again, the pandemic has brought light to this issue and has focused on what we need to do in order to help people succeed and be successful in their lives. As I mentioned before, the pandemic is even more impactful for individuals who have underlying mental health conditions, substance abuse disorders, and who are experiencing other traumas. And I would say that the impact within the immigrant and refugee population is even more so. In particular, the traumas that may be experienced by this particular population, basically due to the disproportionate impact of the pandemic based on the lack of health care for those who have been socially marginalized, who may be experiencing increased interaction with law enforcement. All of these additional stressors have and will continue to take a toll on the immigrant and refugee population, resulting in increased distress, increased suicidal ideation, increased intergenerational conflicts within families, further post-traumatic stress, and other psychological disorders. So as I'm speaking with you today, I think the first thing that we have to do as people who care for other people and want to help them move forward in their lives is, one, take care of ourselves. Understand how the pandemic has impacted each one of us. Find a way that we individually can fill our cup, that we can find that balance between life and work, that we're not so engrossed with work that we don't take care of ourselves and those around us. The second thing I think we have to do is acknowledge the fact that we have been experiencing this pandemic close to 3 years, going on 3 years now, and that it has all impacted us in different ways, and that different populations throughout our community, whether it's individuals that have mental health, individuals that struggle with substance use disorders, individuals that may be within the criminal justice system, individuals that may be immigrants, they're all experiencing the pandemic in different ways. And that stress added to the stressors of their life just compound the issues that they're experiencing. And so acknowledging that we're in this situation, acknowledging that there's a lot of unknowns, acknowledging that we can't control everything within our lives is important. Along with that acknowledgement is the understanding that we can control how we react to that. And so we, as individuals, both for the people who are around us and for the clients we serve, we have one or two options. The one option is to share a narrative of distrust, disappointment, of the fact that we've been wronged, that we've lost something, and that this pandemic cannot be overcome. And I see a lot of that throughout our community. I see a lot of incivility and hostility towards one another. We, as members of the community, have a choice to provide that negative narrative, or conversely, share a narrative of hope and resilience. And I think as individuals, as social workers, as caring individuals that want to help our community, that positive narrative is the one that will help us move well beyond this pandemic and be able to allow us to build resilience. And in fact, I would argue that for our young people, for our kids, and for our young adults, that by managing the stress of the pandemic and all of the things that they're experiencing along with the pandemic, we will have a generation that are more resilient than our previous generation, that are more able to cope with situations. Again, this is a moment in time. It's been a long moment in time, going 3 years. But the fact is that there have been a lot of positive things that have come out of this. There are a lot of positive things that have allowed us to look at things differently, that have allowed us to adjust the way that we approach things. And so one of the things that I find interesting is that there are many people that when they talk about the pandemic and the hopes that they have for the future, is they talk about getting back to normal. And I'll be one of the first people that say, I really don't know that I want to get back to normal. I personally wasn't pleased with our current normal. I think we can do better. I think we can focus on supporting one another, eliminating the disparities that exist within our healthcare system, reducing or eliminating the anti-racism that structurally is within multiple systems within our community and within our country. And so I look forward to the new normal, the normal where we are able to manage as a community this global pandemic and help one another, support one another, and build authentic human relationships. You know, there is nothing more powerful than a human relationship. There's nothing more healing than the human relationship. And so as we continue to move through the pandemic, as we begin to loosen the restrictions with social distancing or physical distancing and get back to doing things together and not be so reliant upon the technology that exists, I think it's important that we focus on that ability to have human connection, to build authentic human relationships. And I believe if we focus on those things, we will ensure that not only have we overcome or managed this pandemic, but that we have created that new normal for each one of ourselves as well as our community. And so with that, I'll stop and see what questions you all have.
Thank you, Tim, very much. And just as a reminder, if anyone has any questions, you can put those in the Q&A box at the bottom of the screen. And we can also come back at the end as well if there's time for any additional questions. Tim, I appreciate you just giving us an overview and painting the picture of where we've been in the last months. It's hard to believe the languishing impact that this is having on our community members. And as you stated, the impact is very real that we're seeing for just community members as a whole, but also what that looks like for our immigrant and refugee populations that have limited access to language services in their particular language, which, as we know, from a mental health perspective, can be very important. So I think there's a lot of work for us to continue doing to make sure that we are supporting those in our community to provide therapy services in people's languages of choice. So thank you so much.
Thank you.
I do see we do have a question. Given that immigrants and refugees have experienced trauma in their lives before the pandemic, what specific strategies can we incorporate when working with them?
So I think that's a really good question, because one of the things that I think that I can relate that to is that we here at the Mental Health Center have historically worked with individuals that have experienced multiple traumas within their life. And so as we were entering the pandemic, we were really worried about how the pandemic and all of the kinds of things that were going on would impact specifically the people that we historically have been working with. And what we found is that due to some of the resilience that they built, some of the coping strategies, some of the things that they built in their life, overcoming those other strategies, actually prepared them and helped them manage the current pandemic a little bit better. And so I think from my standpoint, the best thing that we can do in helping people that maybe have experienced a whole host of traumatic events is really look to what strengths and resiliences they bring to the table. And sometimes when people are distressed or experiencing psychological distress, that's hard to find. That's hard to find those strengths and resilience. And so again, that's where I think it's important for us to get back to developing that human relationship, that engagement. One of the things that I think we get so focused on as mental health providers, or even just helping professionals, is that we want to get tasks done. We want to get stuff done. We want to get people helped. And we miss the focus of taking the time to develop that relationship, develop it, and when I say engage in that relationship, because that's when you can begin to see or hear the story of the people that we serve, their experiences, how they overcame those experiences, and then build upon those strengths and resiliencies that they already possess. And so I think that from my perspective, a lot of the folks that we have historically worked with have needed additional support, but we've looked to see what kinds of things they have done, what kind of coping strategies, what kind of strengths they've built throughout their life in overcoming those other strategies or those other traumas. For us, the bigger, I'll just be frank, the people that we see having the most difficult time are adults. Our experience with youngsters has been that they are pretty resilient in and of itself. But for those adults that maybe have not experienced any trauma in their lives, or any natural barriers, they're the ones that are having the hard time. They're the ones that are having the most difficult time managing this time and not knowing how to really put a name or really give it meaning. And so I think that people's experience, their life experience, provides them an inordinate amount of strength. And so what we have to do is find that strength and tap into that. So that would be my suggestion, is that all of the folks that you work with, whether they're refugees or immigrants to the country, they have definitely experienced hardships, whether it's hardships that in many situations, once they are here within our community, that sometimes we create as organizations, whether that be limiting access to healthcare or whatever it might be. The fact is that they have experienced these traumas, they have overcome these traumas, and we need to tap into that strength and find out how we can build upon that.
Thank you, Tim. Appreciate that. Appreciate your time with us this morning, sharing your expertise, and thank you all and your team for the work that you're doing each and every day. Appreciate that.
Thank you.
Thank you. All right. Well, next we will move to our next presenter. We have Ray DeLugalucky, and let me just get everything situated for Ray here. Thank you, Ray. All right. So Ray DeLugalucky is the Assistant Health Director at the Jackson County Health Department. In this role, he leads the Community Engagement and Policy, Communicable Disease Control, Data Analytics, Communications, and COVID-19 Response Divisions at the Health Department. Ray was identified by the Kresge Foundation as a national emerging leader in public health in 2019. Ray is passionate about working at the systems level to shape opportunities for optimal health and well-being for all people living in Jackson County. Good morning, Ray. Thank you for being here with us this morning. We're looking forward to your presentation.
Yeah, good morning. Thank you for the opportunity to be here. It's really inspiring from my perspective just to have the ability to interact with professionals that are serving the populations around the Kansas City metropolitan area and really throughout the region, specifically related to immigrants and refugees, which we know can be left out a lot of the conversations in regards to specific resources and needs. So thank you so much for the opportunity. I'm briefly going to talk about a variety of different questions today. So I'm going to provide an overall update on COVID-19, focusing specifically on what's happening, what's our current status, what's next, what are some of the threats that we face based on what has happened, and how do we move forward. And while the first two components are going to be generalized to a certain extent, I will try to touch upon some of the specific considerations that we need to make as populations, as organizations, as individuals, as we move forward with COVID-19 and other threats that may come. Okay, so let's start with the status update and what's going on with SARS-CoV-2. So the first portion of my presentation is going to focus a little bit on data and information. I've tried to limit numbers as much as possible because really, honestly, who likes looking at just massive spreadsheets of numbers? Some of the people on our staff perhaps, but I do like to visualize just a little bit more. So this is, to start, basically our COVID-19 case rate. And this is our case rate per 100,000 people, population, over a 7-day period. And what you'll see here is the blue, that is actually the case rate per 100,000 population, and the orange is the percent positivity. You might have heard those two metrics. Those are actually two of the more prolific metrics that have been used throughout this pandemic. And this is kind of giving you a view of what we have experienced thus far. And this kind of focuses on Jackson County a little bit, but the trend lines overall are very similar to what we've seen across the region. So as you can see, within our recent history, we've been dealing with Omicron, and Omicron is the latest variant of concern that had shown to be substantially more transmissible than anything we had seen thus far. And it appears to be maybe slightly less severe than Delta, but the sheer volume of cases that we have seen have manifested in more hospitalizations, more deaths than anything we've seen thus far in the pandemic. And I'll draw your attention to the two peaks that we have. We have Delta, which occurred obviously in kind of the late summer or early fall of last year, and then we progressed into Omicron. And this is actually BA.1 lineage, which you might have heard through the news that there is another lineage of Omicron, BA.2, that we'll touch on as we move forward. So where are we? As you can see with that graph and with that substantial surge and peak that we saw with Omicron, You saw that we did peak, and you saw that we moved downward quite rapidly. And so it's important to understand where we are as far as the overall level of community transmission. That dictates a lot. That determines the risk that we face as we move throughout our daily lives. What's the chance that I'm going to come into contact with an individual who's infectious and actively shedding SARS-CoV-2, the virus that causes COVID-19? And so the CDC developed this criteria for determining the level of community transmission. And unfortunately, for the last many months, we have been at the highest level of community transmission. There's low, moderate, substantial, and high, or blue, yellow, orange, and red. And we've been in the red basically for since Delta, basically. And that is dictated by a case rate that is over 100 cases per 100,000 population and a percent positivity that is over 10. At our peak with Omicron, our case rate was 1,700 cases per 100,000 population, and our percent positivity was 35%, which is substantially higher than really anything that the CDC had even imagined as possible when they were kind of creating this initial scale of community transmission. Since that time, and this is reflective of the graph that we saw before as well, we have seen a substantial decline in cases overall, which is fantastic news. Our case rate, I have a few sources here just to kind of show you that there's some discrepancy between sources, but this gives you an idea of where we're at. Our case rate is between 92, which is below the highest level of community transmission, up to 124.89 per the CDC. And that is a massive improvement from where we've been. However, we still remain at a relatively high level. COVID-19 is certainly out there. We know the virus that causes COVID-19 is still actively circulating in our community, but we're making improvement. At the same time, our percent positivity has also drastically decreased, which was reflective on the last graph as well, from upwards of 35% to below 10% recently, which is fantastic. So what have we seen? Who's been driving a lot of this spread? It has shifted throughout the pandemic and even throughout Omicron. When we saw the initial surge of Omicron, younger youth in particular, so those 10 to 19, had between the third and fourth highest case rate of all age groups. But the 20 to 44 age groups have, without a doubt, stood out through the entire pandemic as not only having the highest case rate continuously, but also showing the lowest aptitude for one of our most important mitigation measures, which is vaccinations. And this was important when we were dealing with other variants because the vaccine was quite effective at limiting transmission. So if I was exposed, perhaps I would either contract a mild case or I wouldn't contract the virus at all. That changed with Omicron. We saw much more breakthrough infections. But the 20 to 44 age group drove most of the pandemic over the last year and a half in regards to what we saw, particularly with Delta and Omicron. So school-age children, we saw a trend that mirrored in a very similar way that of the population overall. And there were periods of time where our school systems implemented more stringent mitigation measures than the population overall. And we saw distinctions in the case rate. But then there were many times when, our schools were the only ones implementing mitigation measures, and children were still getting infected in home and in the community. And our mitigation measures weren't as successful as they could have possibly been. But overall, right now, at least, as we exit this surge, the trends as far as case rate per 100,000 population for youth and for the population overall are very, very similar. So hospitalizations is, at this point in the pandemic, one of the most important indicators among a few others for determining the impact of waves on our population overall. And so as you can see with this last wave right here, this was Omicron, this was Delta, these were some of the other variants, Alpha, Beta, some of those others that circulated early on. Omicron, we saw the highest level of hospitalizations across the Kansas City metropolitan area. And this is important for a number of reasons. Not only are we seeing a tremendous number of, or a tremendous amount of suffering, and with COVID in particular, if you've seen any stories about individuals that have to go into the hospital system, not being able to breathe and struggling to breathe is one of the more, honestly, as a provider, one of the more traumatic things that you can witness, especially as a provider that's not used to seeing that amount of suffering. And so we saw a substantial surge in the amount of hospitalizations, and that really brought our healthcare system in the Kansas City metropolitan area to the brink, where we were considering implementing crisis standards of care, where we were basically trying to determine who gets care and who doesn't, where individuals out in Kansas were dying in smaller rural hospitals and clinics, waiting to be transferred to larger hospitals, where really necessary treatments, like treatments for cancer and so many other important conditions were being delayed simply because we didn't have the bed space available. It was a very traumatic time for us as a community and a population. And we really saw the potential of what this virus can do for us and to us as a community moving forward. Thankfully, our daily average of new hospitalizations is decreasing. It's not decreasing as fast as our case rate, perhaps, but we are still averaging about 100 hospitalizations per day in the Kansas City area, which is an improvement, and we are moving in the right direction. So vaccinations. Vaccinations are one of the most important mitigation measures that we can take as a population to prevent the worst outcomes associated with SARS-CoV-2. Without a doubt, we have plenty of data at this point to show their effectiveness. And I'll kind of highlight that on the right-hand side just in a moment. So in regards to our population, and this varies a little bit from county to county, but it is similar to a certain extent. So 62.48% of our population has initiated a vaccination, or at least one dose. 55% have completed a 2-dose series, and 32% of the population is completely up to date. So they've received their 2 doses and boosters as recommended. Unfortunately, those numbers are inadequate to provide us the best amount of protection that we can take from vaccinations, particularly reducing the amount of individuals that are going into the hospital system with severe cases of COVID-19, and also preventing the worst outcomes, which is death, obviously. And what we saw in January 22, or January of this year in particular, we saw the highest number of deaths out of any time in the pandemic. And most particular, we saw that massive disparity in regards to who is dying. This trend mirrors that for those individuals who are going into the hospitalization as well. It's the exact same type of trend. So the orange is those who are unvaccinated. The blue is individuals who are under-vaccinated, which became more and more relevant as we dealt with the Omicron variant in particular, which had a higher degree of immune escape than any other variant we had seen. And then the green is individuals that were fully up to date on vaccinations. And so as you can see by the trend overall throughout the pandemic, but in particularly in January, those who are unvaccinated, under-vaccinated, overwhelmingly saw the worst outcomes associated with the pandemic than any other group. And this is especially important as we see that there are disparities in vaccination rates amongst different groups. It becomes critically important that we give equal opportunity to every population, including immigrants and refugees, to receive these really life-saving therapies and preventative measures wherever possible. And that needs to be a priority as we move forward and deal with the pandemic. So I'll just briefly kind of demonstrate this. I'm not going to go into the data on this. We have seen disparities throughout this pandemic in case rate and death rate, in pretty much every category you can imagine. Native Hawaiian and Pacific Islander have driven very, very high case rates, much higher than many of our other different groups. As you can see, there are large disparities between our Black or African American, our American Indian, and then our white and Asian groups as well, which have perpetuated just like they have in a number of other health areas. This is the death rate per 100,000 population. Again, substantial disparities in terms of different groups of populations in regards to the experience with COVID-19. And this needs to be on our minds as we move forward, because again, we're seeing similar trends. As Tim had said in his presentation, which was spot on, we're seeing the manifestation of trends that we've seen all along. It's just a different thing, but they persist in other ways, which leads us to understand that there are structural components to a lot of the challenges that we're facing as a community. So core interventions initially, it started obviously with the pandemic in case investigation, contact tracing, isolation, quarantine. Those are all terms that you guys have heard at this point. We had, those mitigation measures, those non-pharmaceutical interventions early on, because we simply didn't have more effective mitigation measures like vaccines or therapies. And those really drove the first wave or first phase of response to COVID-19. The idea that we could combat the virus with non-pharmaceutical interventions. And for most of the time when these things were implemented effectively, we were able to blunt the curve. We know at this point that masks are effective. Nothing is a silver bullet, but masks are effective when used in tandem with other mitigation measures to interrupt transmission to a certain extent, in the same way that testing is, and in the same way that social distancing is. And so these were used exclusively in the first phase of the pandemic, to control the spread. And vaccinations really changed the game for us. And it allowed us an opportunity to protect people from the worst outcomes of SARS-CoV-2. And as we can see, as we talk about the threats, that's going to kind of change in the next phase of our response to the pandemic as we evolve with our knowledge. So what is next? What are the threats that we face? What has these massive spikes in infection and hospitalization and death? What does it cause? What are the challenges that it has caused? And one of the big things that we have to consider for the future is responding to consequences of the pandemic. And the consequences are wide and varied. One of the challenges that we face as a nation is always establishing like a dichotomy of it's either this or it's this. It's either school or it's preventing kids from being infected. It's either our jobs or preventing people from being infected. And that is absolutely not how we should be thinking about this. It's absolutely just an asinine way to view a very complex and deeply seated challenge that is affecting a whole wide array of different systems and structures throughout our lives. And so obviously there have been tremendous economic consequences of the pandemic, premature death, workplace absenteeism, a reduction in productivity. Just in the Kansas City area alone, the social costs of the amount of people that have died in the Kansas City metropolitan area are immense. But you also consider the economic impacts of those deaths as well. And you're talking about $600–700 million of impacts in lost wages and lost productivity and lost economic opportunity. These are really painful things for our systems and structures in our community to absorb that amount of death and hardship. And we're not even talking about the disability that people experience and the illness and that they experience, which is substantial. In addition to that, there are industry specific harms. So we know that, in regards to different populations, different populations have absorbed different levels of risk throughout this pandemic. That whole concept of essential workers, that's essentially talking about different levels of risk that you are putting people in the way of. And, and that's hard. And we've had, obviously, like the tourism industry and different elements of like that, like the hospitality industry have suffered throughout COVID-19 throughout the country and the world. We know that there's been individual and family financial strain. We know that, there's a lot of unmet need. And a lot of that is perpetuated by, the systems and structures that exist within our communities. Tim did a fantastic job of touching on the mental aspects, kind of the social components. So I won't necessarily touch on those, but misinformation is absolutely rampant. The erosion of scientific trust and the erosion of the ability to even discern what is true and what is not true. It has been amplified through our experience in the pandemic. But what I'm going to talk about or focus on, at least through my bit of the conversation, is the health component. And so, the idea of like, we have infection, we have, serious outcomes of that, but are there prolonged impacts associated with our health? And what we're learning from, our experience with post-COVID or long COVID is that there very well may be an additional burden that is placed in our populations, especially those populations that were subjected to higher risk of being infected throughout the pandemic, that may cause additional harm on our population. So in short, post-COVID syndrome, long COVID, right now there's a ton of research going on at this, and we don't know a lot about this. So I'm not going to speak in absolutes about what is and what isn't long COVID at this time. But, studies estimate that between 10 and 30% of people infected with SARS-CoV-2 may develop long-term symptoms. And some of those individuals are individuals that didn't have severe outcomes initially. They may have had a mild infection, but they're still developing long-term symptoms that are unexplainable to a certain extent. And I'll touch on some of the impacts to different bodily systems just briefly. So the immune system, what we're seeing generally from a few studies that have come out and preliminary results is long COVID patients appear to have disrupted immune systems compared to those individuals who fully recover. And there's a variety of different theories and hypotheses in regards to why that is. As you can see in these magnifications, these little dark dots are actual remnants of the virus that can be found throughout the body of individuals that recover and have long COVID associated symptoms. And so it's very important that we begin to understand what are the mechanisms that are at play here in regards to this disruption to our immune system and why some of these symptoms are developing or existing or persisting as we move forward. Same with the circulatory and nervous system. A common complaint that we hear is individuals with long COVID struggling with physical activity after initial infection. And this can be caused by dysfunction of the circulatory system, relating to damaged nerve fibers that have been found in individuals with long COVID. We also have some preliminary research that's looking at these microscopic blood clots that form during an initial infection, which normally break down naturally, persisting in individuals with long COVID and causing some of the symptoms associated with that kind of physical exhaustion. The brain. This is perhaps one of the more frequent complaints because it's one of the more unknown, aspects as far as what's the physiological component behind it. And so even in mild cases of COVID-19, we can see these cognitive impairments, so the reduced attention, memory, word finding. But we're also seeing that dysfunction in the brains of long COVID patients in a way that is similar to what we see with problems associated with aging and some of those neurodegenerative diseases. So these slides on the right, the darker stains are immune cells called microglia. And we see kind of a different pattern between an individual who doesn't have or didn't have COVID-19 and individuals that have COVID-19. And this is both in the gray matter and white matter of the brains, indicating that there could be potential impacts specifically in our brain that are not understood at this time. There's also additional studies that have looked at the reduction in the amount of blood that reaches the brain, which is causing or contributing to some of these symptoms overall as well. Respiratory symptom, again, another common one. I'll kind of just jump on past this one a little bit. You can see that there is some dysfunction in different functionality scans of the lungs overall. This is actually pediatrics. This is youth. And this is a very similar trend between youth and adults, showing that we could potentially see some impacts to both populations as we move forward in regards to functionality. And understanding, why people are having issues with shortness of breath and respiratory problems. So what does that all mean, right? One of the biggest questions as far as what's next, and this is something that we get asked a lot. There's a lot of expectation from policymakers and everyone, rightly so, is like, what are we going to do moving forward? Are we going to experience another variant? Are we going to experience another surge? What do we do? At this point, what we would say is we don't know. We don't know what's going to happen per se. But what we can say is that the eradication of SARS-CoV-2 is highly unlikely at this point, just given societal response across the world, given the ability of SARS-CoV-2 to hide in animal reservoirs. The elimination of the virus is very unlikely. But that being said, we can see different paths of evolution that will impact our populations as we move forward. So the first one is what a lot of people are talking about right now, and it's often associated with an endemic state. I'm sure you've heard that term before. And so this is just saying that the virus is going to follow a trajectory where it's basically going to lose some of its ability to cause substantial damage to the human body. It kind of results in more of like an influenza state where it still may be severe for some people, but it's a relatively equal pattern of seasonality and infection, and we can kind of predict where it's going to be, and we can take appropriate measures like we do for the flu. And so a lot of people are moving towards that path simply because they don't want to acknowledge the fact that there are other possibilities associated with the evolution of COVID-2. So the second one is a variant emerges that evades current vaccines. And we kind of saw components of that with Omicron, BA1 and BA2. Omicron in particular had the ability to evade some of the protective factors of our vaccines. They were still really effective at preventing hospitalization and death, but they didn't do as good of a job at preventing infection overall. And we saw a substantial amount of breakthrough cases in individuals who had been fully vaccinated. A lot of the times they had a more mild case, but it was still possible. There could be a scenario emerge that we see something like that with Omicron, or we see a variant that completely evades the vaccines that we have and therapies that we have, which would be tremendously impactful, especially if it has a high level of transmissibility. Scenario 3 kind of fits along that, in that there's a variant that emerges that is resistant to our antiviral strategies. So we have certain therapies right now. Remdesivir is one, that monoclonal antibodies is another, that allows us to, basically have something to treat and to make people better. There could be a strain that emerges that evades a lot of that. And scenario 4 is like worst case scenario, but still at high levels of transmission, something that needs to be talked about and acknowledged. And that is a variant emerges that causes severe disease in a larger proportion of the population. Just to give you an example of that. SARS-CoV-2 is a coronavirus, right? I'm sure a lot of us have heard of SARS, the original SARS, and MERS. SARS-CoV-2 has a mortality rate less than 1%. And that, nevertheless, we've seen, close to 1 million Americans who have died because of it. The mortality rate for SARS is high. It's 10%, right? Can you imagine a virus that is transmissible that has 10 times the amount of death that we could see? MERS has a mortality rate of 35% with 50% mortality over 60. It's incredible to think that there are very real threats that exist that are just mutations away from happening. Now, I don't expect that to happen. But again, it just shows the threats that we face as populations, and the reason that we need to consider our systems and structures as we move forward to ensure that all human beings have access to those basic components of health and well-being, so that as we face threats in the near term, we can adapt to them effectively. So how do we move forward, right? That's another big question that we're facing. And the answer lies in a variety of different solutions. It's complex, it's nuanced. There's a lot of components to this, and this slide by itself does not do those justice. But here are some of the things that public health is doing, and some of the things we can do as a community to find success against COVID-19 and to be effective. One of the things is community surveillance and intervention. We need to be able to tell what's moving through our populations, and we need to be able to intervene appropriately. One of the things we frequently see in communicable disease control is targeted outbreaks. We see outbreaks associated with a daycare or a church or whatever. We have the ability to be targeted and intervene specifically to protect the rest of the population and protect those in that setting. We need to be able to do the same thing with SARS-CoV-2. And that really entails revolutionizing, modernizing our systems and structures around how we tell how the virus is moving through our country. And an acknowledgement that our public health and healthcare systems within this country are substantially broken. This has been highlighted very, very apparently by COVID-19 amongst all of the other things that we faced before the pandemic began. Personal mitigation. So having the ability to have access to high quality preventative measures like masks, so KN95s, N95s, having access to at-home test kits. So at our health department, we have roughly 50,000 KN95s that have been distributed to organizations across the area that serve key populations like immigrants and refugees, so that they can work with their populations to distribute them as needed. And as we see potentially another surge. The same thing with testing. We're distributing roughly 15,000 at-home tests to those same groups and those same organizations, so that they can, again, as things increase, ensure that those individuals that might not necessarily have access due to limitations associated with documentation checks or status checks, they won't have to worry about that. They can just get the resources to the people as needed. Access to vaccines and treatment. Obviously, vaccines have been a lifesaver thus far. We need to ensure that all people have access to vaccinations. We need to meet them where they are and ensure that we're providing those resources as best we can. And the same goes for treatment. Individuals need to have access to our healthcare system so that they can receive treatment that's going to greatly increase their chances of survival or a better outcome if they do have a more severe case of COVID-19. And then we need to preserve our community systems. We need to understand and look at, our social safety net system, our healthcare system, our public service system. We need to understand how those systems responded to tremendous strain that we saw with SARS-CoV-2. And we need to begin rebuilding those systems so that they can withstand future threats that we're going to face, because we're certainly not going to, SARS-CoV-2 is absolutely not the last virus that we're going to see. We will see another virus. It's unpredictable as to how severe that virus can be, but we have to be able to better respond to it. In the wealthiest country in the world with all of the resources, we need to better position those resources to support the human beings that exist within our country. And then on top of that is advocating. Again, advocating for systems and structural change that have disproportionately impacted people well before COVID-19 showed up. But again, this is another opportunity for us to show that people are not having the same experience in our country. And we need to ensure that we're advocating for specific policies and systems that will address those core components of an experience with opportunity in the United States. Won't touch on IRIS a lot. IRIS is a program that's being used in Wyandotte, Johnson, Jackson counties. It's a solution where you're integrating organizations across a social safety net system. So you're ensuring that individuals have access to resources that may be traditionally siloed. This is just one way of considering how we can rebuild our systems and ensure that, like, even the social safety net system, we're as integrated as we possibly can, and we can answer these questions, right? Which are questions that we have trouble answering now. How does our system respond to different determinants? Who is comprising our systems? Where are their gaps? We can say, like, anecdotally where they are, but we need data, we need information to be able to do that as we move forward. We need the ability to connect people across these systems.
Ray, I'm so sorry to interrupt. I think we're coming up at the end of our time. Do you want to just mention a couple of last few words?
Yeah, no, just these are the last few things. You can read them obviously as we move forward, but there are several different components where we can find success against COVID-19 for the immigrant and refugee populations in particular. And we need to employ these basic strategies as we move forward to ensure that we're giving these communities the best opportunity to fight this virus. Sorry that I blabbed on a little bit. I appreciate the opportunity to talk about this.
No. The thing about it is we could be talking about this and the importance of it probably all day for a whole day session. So I apologize that you have to condense such wonderful information into such a short period of time. But we appreciate that you have shared kind of the overview of Jackson County with vaccination access and kind of what we might be expecting or looking for here. We're all hoping that we continue to get vaccines in people's arms and address some of those hesitancies, which I think is a great segue into our next speaker, who will talk a little bit about what her organization is doing to make sure that there is a reduction in vaccine hesitancy and getting testing out there. So Ray, thank you again so much for sharing all of that valuable information. And those slides will be available as we're recording this session. It'll be on our website for immigrants and refugees, kc.com. Thank you, Ray. Mariana, I will give you a minute to pull up your presentation. Thank you. And while you're doing that, we will introduce you. So we have Mariana Hildreth with Juntos. She's a bilingual communications coordinator. She received her bachelor's degree in communication studies from the University Autonomous of Baja California. Ms. Hildreth has an extensive experience in development of messaging and communication materials targeting minority populations in the health field. She is passionate about community empowerment and improving the health outcomes of underserved communities. As the communications coordinator for Juntos, she coordinates the activities of Juntos Radio, a health video podcast focused on Spanish-speaking Latinos, as well as other community-based materials and strategies. Thank you, Mariana, for being here with us this morning. We'll turn it over to you.
Thank you so much, Andrea, for the introduction, and thank you everyone that is here this morning. Like Andrea mentioned, I'm the communications coordinator for Juntos, and for those who don't know who we are, Juntos is part of the University of Kansas Medical Center. We partner with organizations and the community in research, education, and community service, and we aim to generate and disseminate knowledge to help promote the health of Latinos throughout the state of Kansas, of course, with an emphasis on the Spanish-speaking population. Today, I would like to focus on the challenges and efforts that we've done in the community for COVID-19, including information, vaccination, and testing. Juntos have had, and we still have, two main goals in these efforts. The first one is the dissemination of reliable, culturally and linguistically tailored messaging regarding COVID-19, and to improve the experience of the community in COVID-19 vaccinations and testing events. I'm going to take some time to explain how we came with these two goals. We were able to conduct several focus groups with the Latino population in Kansas, including urban and rural areas, We had 9 focus groups, and we had different categories between 18 and 24 years old, 25 and 54 years old, and parents. So across all groups, the concerns about safety and efficacy of the vaccine were the main concerns. They don't trust the government or the healthcare system because of past experiences, and they are afraid of their information is going to be shared. Also, another barrier are the myths within the community. They will probably listen more to a family member, a neighbor, or somebody that they trust in the community, rather than a health professional or the government. Mandates are confusing for them because there is so many discrepancies across the board, like from county to county, from state to state, from city to city. So they are so confused about which one is the right one, including mask mandates, vaccines. They feel that the safety and the efficacy is not there because it was developed too soon. Also, we talked about the incentives that they were met with skepticism, suspicion, and some of them support them. They just felt that, like, why am I getting paid for getting my COVID vaccine? And it was a little bit suspicious because, again, it was for them developed too fast. Others found out that the support, they found support because they are like, well, maybe I can use the money to do something. Also, in this focus group, we found a couple barriers, and language barrier was one of them. They don't feel that there is enough information in their own language, in this case, Spanish. They also, another barrier that we found is that most of the community, they find their information in Facebook. They don't go to other websites like the CDC. They trust the local churches, schools, and local radio stations. That's where the source of information it comes from for them. So for us to find this information, it was really important because we were working with different organizations to provide safe spaces for COVID-19 information, vaccine, and testing. So moving forward, after we found out this information, we started thinking, how can we improve this experience? And that's basically one of our goals: how to improve the experience of the community in COVID-19 vaccinations and testing events, because we need to provide a safe space. We need to provide a space where they feel comfortable, that we speak their language, they feel comfortable asking questions. So one of the biggest things is, of course, we are a small team, and collaboration is a key. So we have partnered with different organizations, including Heart to Heart International, local parishes, also United Healthcare, Vibrant Health, the Health Equity Task Force of Wyandotte County, the Health Department of Wyandotte County, and much more, to provide these events to the community. So because there is a huge community in the parishes throughout the KC metro area, specifically these ones that we worked was in the Kansas side. We were able to work with the parishes to provide that safe space where people felt comfortable. So we started hosting some vaccination clinics and testing events, and we saw so many changes throughout the different events. We have had from November, and I'm just going to talk about the last ones, which are like 7 events from November to February, because that's when we started seeing the difference. So the first event, we started providing maybe around 100 vaccines. By the 6th event, we were providing 404 COVID-19 vaccines. So we saw the increase, but also that was a challenge because we're a small team and we need help. So, but we were really, really happy that the method that we found was working. 1, being in the community. 2, providing everything in Spanish. We created all the information, flyers, Facebook event. We deliver flyers in local Latino-owned businesses. We put some table of information in those businesses to answer questions about COVID with some materials that we have developed, and I'm going to show in a little bit. And we got a really good response from the community. And we can see that as we reflect the numbers of people getting vaccinated in the last couple months. So far, we have administered from the November to February, 1,734 vaccines and 563 COVID-19 tests. And I'm sharing this because I think it's important to pay attention what things are working and what things are not working, and to pay attention as well to provide the attention and the experience that the community deserve, especially those that do not speak English. And we're still working on that. And our upcoming event is on March 19. It's in Sacred Heart Church in KCK. Please help us spread the word. So I'm gonna take a moment again to talk about how it has worked, how we are working to make this happen. So the collaboration with partnerships are really important. We need to have volunteers that speak Spanish. That's really important. People have questions and they want to feel welcome. They want to feel comfortable. So having people that speak Spanish in the event is really important. Junto staff is small, but we all are bilingual. And we always try to recruit volunteers to be present in our events that speak Spanish, and also provide incentives like gift cards. We also have provided tacos. So the message is like, if you are running late or if you're coming after work, please come because we're gonna feed you. During the holidays, we provided chickens and hams as well. And all this was possible because of the collaboration with different organizations. And also the other thing that has worked for us is, and at the same time is a challenge, we do our events during the weekend, specifically on Sundays, because a lot of people go to church and they are able to go and to get the vaccine or test after church or before church. And of course, the parishes have been a huge help communicating our message and giving out the information that we provide. So that's something that has worked. And of course, it's a challenge because we need to find people that are willing to work on a weekend, especially on a Sunday. But I think our community deserve that. Our community deserve what we're providing and just improve their experience. A lot of people during the events have mentioned how grateful they are because they work 12-hour shift or they work at night, and we know our community, what kind of works they do, and they are limited sometimes in hours, or they are pretty tired and they are not thinking about it. They have so much stuff in their plate. So having them coming on a weekend when they are available, providing them food, it's been a really good incentive, and we've heard that from the community. And that's regarding our vaccine events. We also have other materials and things that we are focusing, which is part of our goal of the dissemination of reliable and culturally and linguistically tailored messaging. And one of them is this development of instructional sticker to accompany a home rapid test that a lot of our community organizations, clinics, and health departments have available. So we created this sticker in Spanish and English, and people can, or organizations can customize this with their information. This was in a partnership with a project called RADXUP, and counties that are part of this project were able to customize this, but this is available for anybody that is interested in having this. Within the efforts to provide information and reliable information, and also incentivize and motivate people to get the vaccine, during our events, we were able to recruit people that were getting the vaccine, or to motivate people to go to our events to get vaccinated. We were able to host a virtual contest event that encourages Latino youth in Wyandotte County to promote awareness on vaccinations against COVID-19. And this was a partnership with the Health Department of Wyandotte County. We had a total of 30 participants, and we had 9 winners. They won $500, and the thing that they needed to do is submit a video of 30 seconds sharing why they decided to get vaccinated and promote the vaccine, and say like and the messages were incredible. They were really, really creative. They shared like, to protect my family, my parents, I want to go back to school, I'm ready to go back to school, I want to see my friends. So I think it was a really good messaging from the community to the community, especially for the younger ones in our community. So this was like a motivation. We also shared the message, and they were able to get an incentive as well for participating. The total of likes that we had in this lasted around 3 weeks and a half, the contest, and we got 1,061 likes and 10,110 views, which is really good in our YouTube channel. Because we were able to see that people were actually sharing the messaging, and they were liking the video, and they were actually watching. And because of that success, we're going to have a top 2.0 contest coming soon. So if you have anybody that is interested in participate, and this is for kids between 5 years old and 23 years old. I'm going to share my information at the end of the presentation. And this is a good opportunity. This was a good opportunity for people to share their feelings about the COVID-19 vaccine and motivate others to get it. These videos were in Spanish, English, and bilingual, because we also understand that the younger generations of immigrants, a lot of them do not speak Spanish, or they feel comfortable in English. So we also don't want to forget about that. Another thing that we are putting together, and is coming up in March, and this is also to motivate more kids to get the vaccine, is a soccer clinic. And in our community of Latino community, soccer is a huge deal. So but many of our kids do not have the opportunity to participate in camps like this. So this is totally free for those who want to participate, and have the only requirement is to be vaccinated. And for those who are 12 years old and older, they have to have their booster shot. And this is totally free, and it includes a soccer ball, a backpack, and a jersey. And this is going to start in March. And again, collaboration is super important. And this is a collaboration again with the Wyandotte County Health Department and Soccer Nation, which is an organization, a big organization in KCK, where they promote a lot of like healthy life and sports, specifically soccer. So this is some examples of things that we've done and worked, and motivates people to come to our events. And everything is in Spanish and English available as well. And all these events and contests and clinics are specifically focused to the Latino community, but they are open for the public as well. Along with our efforts on the actual COVID-19 testing and vaccination sites, we also try to meet our second goal, which is the dissemination of information. And one of them is, and for us, it's really important, the community participation. We work in the community, we are part of the community. So we have an ongoing campaign right now that is called Yo Ya Me Vacuné campaign, which is translate to I got my shot. And this was also a partnership with the health department of Wyandotte County. And we had 12 local businesses, Latino-owned businesses in Wyandotte County that participated in this, and they shared their testimony and a picture, and we created a banner, a printed banner, and they are all around the KCK area. They are hanging in their business inside and outside. Some of them have them indoor, and some of them have them outdoor. And also along that, we were able to collect some pictures and the testimonies of employees, managers, owners, and we created this poster like the one that you see in your screen. And that's a social media campaign. So we have more than, right now, probably 60. I know it says 45. from the businesses, plus another ones from the community, like the priests from the parishes, volunteers. We have other organizations participating in this campaign. So if you're, again, if you're interested, you can send me your picture and your testimony. So they are shared every week, and it's just like a message from, like, this is me, you see me every day, you, not every day, but you see me in the community, and I'm sharing that I got my shot, and to protect my family. And I think that's really incredible, like the participation that we have had in this campaign. And it's still ongoing, and we are sharing it in our social media on Facebook and Instagram. And because of, and this is so important for us, because when we find out, like, the source of information of our community comes from Facebook, almost 100%, we understood that we need to be present. So we are really, really active on Facebook. A lot of our campaigns are in social media, and our website, and in the community. So we try to connect all of them, and that has worked for us so far. Another campaign that we have going on is Pregúntale a Lorito, which translates to Ask Lorito. And Lorito translates to Little Parrot. And basically, Lorito is the Latino cousin of Jayhawk of KU. And Lorito helped answer common questions in Spanish regarding COVID-19 guidelines, testing, and vaccination. Again, the information presented in these flyers, which are digital, and we have printed materials as well in our COVID-19 testing and vaccine events. We share those with other organizations and the business that we partner with. And they are in Spanish. And we also partner again with the Rise Up project to bring some flyers in English and in Vietnamese as well. And we also partner with the Health Equity Task Force of Wyandotte, and we have those. We have several flyers as well in both English and Spanish. And we share this in social media, and like, kids find them like funny, and parents also find them really understandable. Like, they are easy to read. We try to find the right wording, and so people can understand it, because it's overwhelming, the amount of information that is out there regarding COVID-19. And like I mentioned before, a lot of them are confused, and because it is confusing, and we mentioned this before, information keeps changing, and we're still learning, and sometimes people don't understand that. So it is our job to bring that information to them, and be like, and explain why it's changing and how it's changing, and just tailor that messaging for them in their own language, and culturally and linguistically, of course, tailored for them. And finally, we also have a show in Facebook Live. We started as a podcast, named Junto Radio, and now we partner with the Kansas Hispanic and Latino American Affairs Commission to create Kansas Al Día Edición Junto Radio, and where we bring health topics to the community. And now it's Facebook Live, so it has worked so far. We have a lot of views when it's live and on Facebook, because we were doing it on YouTube before. So again, it's just like coming to the source of information our community is seeking. And so we thought this was a good idea, and it's worked so far. And once a month, we bring a COVID-19 update. So we have health professionals, local doctors throughout the state or the country, to talk about and answer questions regarding COVID-19. So it's in Spanish, 100%, and it's been a really good project, because we were able to answer a lot of questions that actually the community do while we are live. And also parishes have participated here in this program, and they send us the questions beforehand, so we are able to ask those questions to the health professionals. So we're just, these are like the things that have worked for us. And of course, we still have a lot of challenges, because it's a lot of work. And we know that we all have a common goal, and I'm saying all as an organizations. So it is important for us to keep in mind the collaboration, to tailor the message to the communities that we want to reach. Language barrier is a huge deal and is still a huge deal. And we need to be concerned about that and make changes in the messaging that we're bringing to the community. It's really important to hear the community. We as Juntos are part of the community. We are in the community, and it's important to bring the best experience for them. So when they refer to more reliable information, they can say, oh yeah, you know, I went to the CDC, or I went to Juntos, or I went to KU, or I went to the health department, my local health department. So that's what I have for today. Here's my contact, and here's my email at Juntos, our website, or Facebook. We're really active on social media, like I mentioned. And please feel free to ask any questions, or if you want to participate in these campaigns, feel free to reach out to me.
Perfect. Thank you, Mariana, so much for sharing all of the efforts that you all have been doing in the last couple of now years. Appreciate that, and the importance of tailoring the information to a variety of different languages. I know that we are coming up right at 10:30, and we will make sure to have all of this information posted on our website with I know Ray is going to share his full slides with us. So we will have that all available to you all. Appreciate that everyone took time to be with us this morning to share this very important information. We have an upcoming event that is hosted by CCIR coming up on March 24th, which is a month from today, hard to believe. It is going to be an in-person event, and the registration details are on our Facebook page, Immigrants and Refugees KC. It is called The Intersection of Culture and Trauma in the Care of Diverse Populations. So it'll be a very in-person event that is going to have us doing hands-on work and working with one another. So be on the lookout for that information. We had to open up more slots because the need was just out there to have more participants. So we're very grateful for that. Thank you. As we wrap up our time, thank you again for being with us on behalf of Communities Concerned for Immigrants and Refugees. We want to take a time to thank Tim, Ray, and Mariana for sharing their expertise with us. We'll do a virtual round of applause for you all. Thank you. Thank you. Enjoy the rest of your day and take care. Bye-bye.